I think it's that they really do come with a huge knowledge base, that year of didactic, or 15 months, whatever the didactic period was, I know by the end, every student, even the brightest, will tell you, I don't know anything, I just memorized for tests, is that they really do have a fund of knowledge, and that they should use that fund of knowledge. You know, students come, I give talks all the time to students, and they come and they're always looking for the perfect book. And I remember I went with a classmate of mine, she was always buying a new book, and I said, did you ever think that it's not one book, that there's lots of things? And so use your resources well, and there are many resources, but the biggest resource you have is your own brain. And that to not give up on yourself, that you've learned these things, and that to use that brain and to continue to build the formulary of medications, that you're not going to know them all, but as you use them, you'll learn them so that you don't have to keep looking them up. But that to really use that knowledge base that you gained and enhanced and built during your didactic phase of your education, and have faith in that. I think that students need to understand that every experience is going to be different, and I always say to them, understand that. When you're all in the classroom together, you all hear it the same and you say, oh, this is what it is. But when you're in clinical, everyone has a different experience, and so that you have to accept that you may learn something at a different point. And one of my favorite examples is, all of us have students say you have to do GYN exams, you have to examine females. And but I will tell you that sometimes our students do more of those exams in their family medicine rotation or their emergency medicine rotation than they did in their OB/GYN rotation. So to be patient, that the whole year needs to happen, that things will happen at different points. I think another thing to become prepared is that students should gather their resources and have those resources in a place so that they become more efficient, and to do some prep work up front about going to places, knowing what the population looks like, and to not and to use common sense, I would say, is a pearl. Use common sense. When you go to a new site, remember you're a guest. Whether it's a large institution, a federally qualified healthcare system, a small private practice in a large area, a small town, is that you are a guest there. Be respectful, be thankful, always thank the preceptor, and never just assume that because this is what everyone was doing in the office that it's okay for you to do that. Always ask what they want you to do, whether it's your dress, how they want you to see patients, what time they'd like you to be there. And then the other pearl is put everything into it. That don't meet expectations, exceed expectations in every rotation. Get there early, stay late. If they tell you to go home, say, no, I'm going to stay late with you, or put in those extra hours because it really will benefit.